You are listening to Skin, Earth, Vitality, the podcast where ancient wisdom meets modern vitality. If you're seeking to reconnect with your innate vibrancy, you're in the right place. I'm Emily Davis, a seasoned holistic esthetician and herbalist. Join us as we unlock the secrets of ancient skincare practices, explore the beauty of seasonal living, herbalism, and true holistic well-being for you and the broader ecosystem. Hello. I am back and kind of cool. This is episode number 10. So that's a milestone to celebrate. I'm pretty proud of myself for that. We've been here 10 consecutive weeks, and here's to 5,000 more. If you're new to me, I'm an esthetician and an herbalist, and in my practice, I specialize in facial massage. I have been doing so for, I would guess, the last 6 years or so. I've been an esthetician for 17 years this year. And so with that came needing to understand what's happening below the skin with the muscles, the connective tissue, the extracellular matrix, the blood, the lymph. And today I want to talk about a topic that comes up for, I would say, 8 or 9 out of 10 of my clients. And that is jaw tension and jaw pain. And you might be thinking, this is a show about skin. Why are we talking about the jaw? But jaw tension is actually going to have an effect on the health of the skin, on the way the face ages, and of course, on the shape of the face. So today I want to talk about why that is and what you can do to help and hopefully get you some relief, because I know from firsthand experience how uncomfortable it can be. Of course, as always, nothing discussed here is personalized advice, and certainly nothing I say should be taken as medical advice. The ideas that are discussed are meant to inspire deeper thought, further research, and if you're working with a practitioner to dive deeper, that feels aligned, and I fully support that. There are a plethora of amazing holistic dentists who specialize in TMJ, chiropractors, acupuncturists, physical therapists, or other specialized body workers who you can work with. My purpose today is really to discuss how tension in the jaw can affect the skin, because that is my area of expertise. So, what causes jaw tension? Obviously, there are many variables, but some common causes include stress, improper posture, as slouching or hunching forward can contribute to muscle imbalances and tension in the neck, and of course, the shoulders and the jaw. Teeth clenching or teeth grinding is a big one. This is called bruxism. TMJ dysfunction. So the temporomandibular joint, TMJ, is the joint that connects the jawbone to the skull's temporal bone. TMJ dysfunction can occur when there's a dysfunction or a misalignment of this jaw joint, which is going to lead to pain, stiffness, restricted movement. Other common causes of jaw tension are muscle overuse. So this is going to look like excessive or repetitive use of the jaw muscles. Chewing gum excessively is a big one for this. But again, that bruxism, the clenching or the grinding, can lead to muscle fatigue and tension over time. Interestingly, food sensitivities and allergies can have an inflammatory response that cause tension in the joint, and they can also trigger bruxism. inflammation or arthritis in the joint. Mouth breathing can disrupt natural tongue posture, leading to muscle imbalance in the jaw area. Infection can be a contributor to jaw pain. And I would say you definitely want to rule out infection before moving into any of my solutions that I offer today. Facial massage is definitely contraindicated if there is an active infection of any kind. And so, if this is the reason, then I would highly suggest taking care of that before you move into any of the other solutions. Parasites can cause bruxism, which can then lead to jaw tension. And it's also interesting to note that our jaw and our hips are actually very intimately connected. And although it varies from body to body, it's very common for someone who experiences tightness in the hips to experience this in their jaw as well. And this is through what are called fascia trains. These are trains of this connective tissue, the fascia, that run all throughout the body, holding everything together. And we have one called the deep frontal line that connects the jaw to the hip. So let's move on to the link between jaw tension and skin health. Your jaw muscles and the rest of your face are obviously super connected and work together to help you do things like chew your food and talk and even show expressions like smiling or frowning. These muscles in your jaw, like the masseter, which is your chewing muscle, and your temporalis, which is the muscle at your temple right above your ear. They attach to different parts of your skull and your jawbone. They get messages from your brain through nerves and get the blood that they need to work properly through your blood vessels. Plus, there are tissue like fascia, which we talked about, and ligaments that hold everything together in place and they make sure that your movements are smooth. So, when everything's working well together, you can do all the things you need to with your face without any problems. However, chronic jaw tension can negatively impact the skin through various mechanisms, including increased inflammation, which can decrease circulation and compromise lymphatic drainage. I cannot speak enough to how important both of these are to healthy skin. And it can kind of feel like an abstract concept, but I can tell you that after working with thousands of people with their skin, having healthy lymph flow will absolutely affect the appearance and texture of your skin. The lymph is there to carry away waste, but also to act as a transport system. So, the lymph, about a third of our lymph, which is a big part of our immune system, it's like this clear fluid that flows through vessels below the surface of your skin in a similar way that blood flows through vessels. And it is going to all go from your head past your jaw to your neck. And as I said, a third of your lymph system is happening in your head. And so a lot of your lymph has to move past your jaw. And these lymph vessels are smaller than a strand of hair. And if they're moving past the jaw and we've got a ton of tension, or if the muscle has bulked up from becoming so tense, that's going to be kind of like stepping on a hose, and it's not going to let the fluid through again, because those lymph vessels are about the size of a strand of hair. And so any pressure on there is going to back that up. If you have impaired lymph drainage, the skin can be more dry. It can take on like a gray, dull appearance. It can be more prone to rashes. It can be flaky. You might see breakouts, clogged pores, even hyperpigmentation. So it's a big deal. We should not sleep on lymph drainage. It's super important. The constant strain on the jaw can lead to the release of inflammatory muscle molecules, which trigger a localized inflammatory response in the surrounding tissue. And this can manifest as redness, swelling, and contribute to issues like acne, rosacea, eczema. And additionally, it can restrict blood flow, which deprives the skin cells of the oxygen and nutrients that they need to function in a healthy way and for skin regeneration. And additionally, popping back to lymphatic drainage, that can have a huge impact on the shape of our face, also the appearance of under eye bags, fluid retention, puffiness, facial swelling. I can't tell you how cool it is as a body worker, as an esthetician, to be able to do manual lymphatic drainage on somebody and before your eyes see the bags under the eyes start to reduce in a big way, to be able to see the shape of the face thin out quite a bit. It's pretty extraordinary. So, the impact on facial aging. And yes, I am anti-aging. Aging's a gift. I have no desire to look like I'm 22, but there is a difference between healthy aging and what we call stagnant aging. Jaw tension contributes to stagnant aging. Increased muscle tension, like I already said, can impair blood circulation and lymphatic drainage, which can reduce nutrient flow to the cells, and that will cause stagnation in the face. And stagnation is cellular death. It can cause increased appearance of aging, it can cause premature aging. Additionally, muscle tension can pull the skin downward, increasing the appearance of jowls. It can put a strain on the surrounding muscles, causing overcompensation, which can lead to facial asymmetry, as well as an increase in or deepening of dynamic wrinkles, which are wrinkles caused by repetitive facial expression. And what happens here is the muscles start to shorten. And if you can imagine like a rubber band that's stretched out and then it starts to shorten, anything that might be attached to that rubber band will wrinkle. Same thing with the skin. Addressing jaw tension can alleviate these symptoms and it can improve the flow of fluid again. As a great mentor of mine and an esthetician that I admire so much, Angela Peck often says, no flow, no glow. Meaning, if you don't have a healthy flow of the fluids, your blood, your lymph, etc., you're going to see dull, lackluster, dry skin. So let's speak to some approaches to relieving this jaw tension. Of course, you first want to understand why you have jaw tension, and hopefully, some of the reasons listed previously will help you get started down this exploratory path. And I just want to note one more time that if the reason you have jaw pain is due to an infection, a tooth infection, wherever it may be, facial massage or neck massage, all of these are not something that you want to participate in at the moment when you have an active infection. So make sure that you get that addressed prior to moving into my favorite way to address jaw tension, which is self massage. Self massage can be just such a wonderful way to take some time out for yourself, and it's going to improve the appearance and health of your skin. So for jaw tension specifically, I really love to massage the SCM muscle, the sternocleidomastoid muscle, which is a large muscle located in the front of the neck. So it inserts right behind the ear at the mastoid process and comes down to the clavicle. It kind of wraps around your neck. And you can feel this when you're moving your head from side to side. You can flex your neck and it will pop out. I like to place my thumb and my pointer finger on one on each side of this muscle, and then do that with both hands and gently, gently stretch them away from each other. One hand moving downward toward the clavicle, one hand moving upward towards the ear. And everyone's a little different. Some people's SCM is easier to find or get a hold of than others. If it's so tight that you can't grab it, gently massage the belly of the muscle. And there's this tool that I love. There's no affiliation here, but it's called the Lanshin massager. If you Google treatments by Lanshin massager, it'll pop up. It looks like a little sea creature, and you fill it with water from your kettle. And as soon as it's cool enough for the skin, you can utilize this on that SCM muscle. You can really use it all over your neck. And then moving into the other two muscles that I highly recommend working with for jaw tension, the temporalis, which is that muscle that's right above your ear. You can bite down and feel it moving. It'll pop out a little bit. I really love to use the meaty part of my hand right below my thumb to get into this area, to maybe do some circles, maybe press in with both hands at the same time and move upward. You can take your fingers, your middle finger and your ring finger, and with both hands do small opposing C's on the temporalis to help release it. Get in there and be intuitive, and whatever feels good to help release that muscle. It can have a very strong impact on the next muscle that we'll talk about, which is the masseter. So this is your chewing muscle. And you can feel this when you bite down. Of course, it's again going to pop out. And you can, from the outside, release your masseter by massaging in small circles with your fingers. You can hold at the TMJ joint and then maybe using like some medium pressure, go in with your ring finger and your middle finger, moving down that muscle with some good pressure there, trying to release it, staying right on that masseter muscle. But this one, I really love at home intraoral massage for this. So when you do your at home intraoral massage, the shower is a great place because you can let the heat from the shower warm the muscle a little bit, and your hands are already clean, which is a plus. So go across your body. If you're working your left hand side masseter muscle, that chewing muscle, you'll take your right hand. And like I said, move across your body, bring the thumb inside of the mouth and the four fingers to the masseter muscle on the outside. And you can bite down, not on your thumb, but just bite down. And this will let you feel where that chewing muscle is. And you can do some gentle small circles. You can work on elongating that muscle by moving downward in the direction toward your toes or towards your clavicle. So that's facial massage. Obviously, this is audio and it's not as easy as watching a video. If you head to my YouTube or to my Instagram, I often will share massages that help with jaw issues. But next up is stress management strategies. So, of course, if stress is a contributing factor for your jaw tension and jaw pain, working to manage your stress or manage the way you view your stress can be really important. I love breathing exercises. I'm a big fan of meditation. Yoga is amazing because it's also going to help with the posture issues that could be contributing as well. And then I also really like both nervine and adaptogen herbs. Nervine herbs are a category of plants that have a beneficial effect on the nervous system. So, we have stimulant nervines, which support alertness and focus, like ginkgo and rosemary. And I'm explaining all of the different nervines to tell you that not all nervines are made equally, and we're looking for a very specific type of nervine for stress. So, our stimulant nervines, we have sedative nervines, which help to induce sleep, like hops or valerian, although it is very interesting that it's estimated around 10% of the population actually is stimulated by valerian, and I am one of those rare people. So, tread lightly with valerian. Another one is skullcap is a sedative nervine. Tonic nervines, which support and nourish the nervous system, like milky oat seed. And then we have relaxant nervines, which have a calming and soothing effect on the nervous system. So, examples of this are chamomile and passion flower. So, depending on where your stress you probably don't want a stimulating nervine. It's probably not going to do the trick that you're looking for. Herbs are just so dynamic, and I don't like to say, there's this herb for this problem because, like lemon balm for stress. It really depends on what your stress is, why you're stressed. So looking into what specific plant can help your particular brand of stress. I do think that passion flower is one that's pretty um, broad, I guess you could say. Milky oats are also one of my absolute favorites to just help calm everything quite quickly. And then little chamomile, sweet little chamomile. Um, that's such an accessible herb and such a um, I think it's one that most people can tolerate. So check them out. Remembering this is not medical advice. You always want to understand what an herb is doing, contraindications for herbs, drug interactions with herbs. But I just want to talk about some that can potentially help you. Adaptogen is a kind of blanket statement for a broad class of herbs that can help the body adapt better to stress. And again, this isn't about removing stress, that's impossible. And also, stress can be a great thing, and stress can do wonderful things in our life, but it's that chronic stress and the inability to cope with stress. And that's where adaptogens can really help. So, we're not looking for adaptogens that are buzzy and that can keep you going past when you need to rest. Those would be like rhodiola or eleuthero, Asian ginseng. We're talking more like calming, psychologically nourishing adaptogens like holy basil, reishi mushroom, ashwagandha. And keep in mind, Not every herb is appropriate for every body. Ashwagandha can definitely interact with thyroid medication. It can, even if it's unmedicated thyroid issues, you do want to be careful with ashwagandha. Um, so, yeah, look into if a plant is right for your body. Proper posture and ergonomics. So, again, working with exercises, stretches, yoga, noticing when your posture has become slack or slouchy. Doing regular massage is really important for posture. Maybe seeking professional help like massage therapy or chiropractic care or acupuncture. And then popping back to herbs once again, agrimony. Agrimony has a very interesting affinity for the jaw. I first learned this from Organic Olivia. And since then, I've seen many things come up, and I've actually worked with agrimony and felt this firsthand experience in my own body. Agrimony contains compounds that can be mildly sedative, which can help to relax tense muscles, including those in the jaw. It has an anti-inflammatory and analgesic or pain relieving properties to it. And it is important to understand that agrimony can be quite drying. It's a strong astringent. And so this one is really lovely to pair with a moistening herb like marshmallow or linden or rosehip. It's generally considered as a mild herb. Um, and again, you look into if it's the right plant for your body. But all of these plants can be ordered through Mountain Rose Herbs. I will put a link in the show notes for Mountain Rose Herbs. And if you have a local apothecary in your town, that's a really wonderful choice because you can pop in and speak to an herbalist and get more individualized advice if you are to get a consultation or an appointment with a clinical herbalist, or even more just education if you're speaking to the person who's working there. And finally, if you know that you are mouth breathing, working instead to breathe through your nose, there's a fantastic book called Breathe, and I highly recommend that. I can't remember now if it's Breathe or Breath. I think it's Breathe. But I highly recommend that if you do believe that your mouth breathing. Tape can be really helpful. There's little nose pieces that can open nasal passageways. So all of these interventions can be really helpful for making sure that you are breathing primarily through your nose, because mouth breathing has such an effect on your overall well-being, but of course can be problematic for jaw tension. So today we discussed a few causes of jaw tension, what it does to the skin, and some accessible solutions. I hope that you walk away from this with something new in your tool belt, something that can help you. Thank you so much for tuning in. If you enjoyed yourself, I would love if you would subscribe and rate the show so that I can keep reaching people who are looking for holistic solutions for their skin. Join me next time when I ask and answer the question, is face massage an alternative to Botox? The answer might surprise you. Until then, be well.